I got a couple of questions about specific lasers that have come in, if I may.
Yep.
This one's from Mark, who says he's a practicing chiropractor and has a Thor laser in his clinic,
Yep.
which he's used for a few years, generally with good results. He's dealing with a chronic subacromial bursitis, which has been diagnosed by an ultrasound scan that was done at the Bournemouth College. It's not responding as fast as he'd like, and he'd be interested in knowing the treatment protocols that you would use for that condition with the type of laser that he's got.
Yeah,
with the type of laser that you use.
Understood. I mean, James Carroll is one of the four-founders of laser therapy. So he set up Thor Company, and it's a British company. But the majority of, all of his lasers are class 3B, and therefore their power levels are less, and therefore you need to either hold them there for longer, or you have thousands of small, and they tend to be LEDs and not lasers, that they end up putting on the tissue structure. And so it's a compromise in regards of how you're going to do it. Either he has to spend longer with the laser over the area that he's trying to treat, or potentially, with the Thor laser, they have a little pen, and that's the only one which is a true laser. The rest of them tend to be LED heads with a couple of laser beams within it.
Okay.
So it's a time
I don't know
factor.
which sort that Mark is using. He hasn't said that. He does say it's
They tend to
a
come
laser.
with a range of different heads.
Oh, okay.
Some LEDs, some with a laser, and therefore it's a time factor. The longer you actually take on it, the more efficient you will be at actually treating some of those deeper tissues.
So essentially what we're saying...
Of course, yeah, go on.
Yeah, I think also clinically you've got the distal pain fibres, but you've also got the more central spinal nerve root pain fibres.
Yeah.
So sometimes with the more chronic, longer-term conditions, then it's worthwhile actually working on, obviously, the area concerned, but also central aspect where the actual spinal nerve roots are as well. And that sometimes makes a difference in terms of desensitisation for the nerves.
Right, so it's not fixing the problem, but it's taking away some of the pain for the patient.
Yes, in that
While
aspect
the
it
problem
probably
gets
would
fixed.
be, but obviously if you're reducing the pain, then you can get better movement with the shoulder, and then it sometimes has a knock-on effect that you can start to get the movement back.
What's the laser actually doing for a bursitis?
Ironically, the areas of inflammation, about the use of lasers for inflammation, is probably the area that's least well researched. Okay, I think the majority of good lasers are improving perfusion and metabolism, and that then has the secondary effect of reducing inflammation.
Yeah.
And so when you're using it on something like a bursitis or an acute inflammatory aspect, you're trying to improve and stabilize that structure, improve the perfusion, but also get rid of some of the inflammatories that are present in there. And not so much on a bursitis, but on an arthritic joint. I think one of the big benefits is once you start going and improving the perfusion to that joint, a lot of the inflammatories which are creating the pain enhancement of the pain receptors there, the IL-1s, the tumor necrosis factors, if you can improve the perfusion, you're going to dissipate a lot of those inflammatories, and therefore the sensitization of the pain fibers is less, and therefore you have a less restricted movement in regards to that. But in regards of what Andy was talking about, there is the secondary effect of a good laser, which is not just a local effect, where someone has had really bad chronic pain in a condition, wherever the condition is. You then sort of get these maladaptive pain syndromes, where you've actually gone and affected the central nerve perception as well. And there's been changes in their dendritic interactions, and therefore treating just the local joint alone is not sufficient for some of these really chronic problems, which a lot of chiropractors and osteopaths get that as almost a secondary or tertiary referral. And when you have that scenario, just doing the local thing is not enough, so you need to treat the correct central nerves to try and, I can only say readjust, but there's some really good research on showing the effect and changes on dendritic interactions, and you'll get sprouting and changes in the nerve roots if you treat that central lumbar, sacral or cervical nerve roots which are supplying the appropriate appendage.